Hello, my name is Agnes Higgins and I'm Professor in Mental Health at the School of Nursing and Midwifery in Trinity College in Dublin. I'm a nurse, researcher and academic, and I've spent most of my clinical career working with and supporting people who experience mental health problems and their families. The focus of this video is on perinatal anxiety. When you hear people talking about mental health challenges that women face in the perinatal period, the focus is often on depression. While it's important that we tell women about depression so that they recognise it and know when to seek help, it's equally important that we tell women about anxiety that they may experience during pregnancy or after the birth of the baby, so that they can recognise when it's happening to them, they can differentiate between normal worries of motherhood and anxiety, and that they know when and how to seek help. How common is perinatal anxiety? Anxiety that occurs during pregnancy or in the postnatal period is as common as depression. In the MAMMI study, 7% of women, that is 1 in every 14 women, told us that they experienced anxiety before they became pregnant. Approximately 1 in 20 women told us that they experienced anxiety during pregnancy, and that increased to 1 in 8 women after the baby was born. 12 months after they had their baby, 1 in 8 women also told us that they experienced anxiety. So you can see that anxiety is common and affects a lot of women. The good news is that help is available, and that help can make a big difference to your life and to your quality of mental health. What is anxiety? Anxiety is a natural response that we all feel if we feel under threat or if we encounter a new or challenging situation. These situations may be very real, such as going into hospital for an appointment, doing an examination, or being told that your baby is ill. We can also have an anxiety response to images that we have in our head, such as imagining somebody hurting or harming a loved one. As pregnancy and birth is a new experience for women, it is normal and natural that women will have certain worries. In many situations, these worries are transient. They are short-lived and can be resolved with reassurance or with explanation. So when do normal worries become anxiety? Normal worries become anxiety when they start to disrupt your life, your relationships, and your ability to enjoy and care for your baby. Normal worries become anxiety when they're constant, when you have difficulty controlling them, that you can't get them out of your mind. Normal worries become anxiety when they are excessive to the situation that you find yourself in. Anxiety will affect women very, very differently. Some women will talk about and tell us that they feel this overwhelming sense of dread that something awful is maybe going to happen to their baby or their loved one. The feeling is pervasive and it often makes it very, very difficult for them to relax and to enjoy being with their baby and to enjoy motherhood. Other women talking about finding themselves crying for no apparent reason and being irritable. They cry not because they're sad, but because sometimes they feel overwhelmed by the situation. Other women tell us that they feel extremely critical of themselves and they feel that they are to blame for everything that is happening in their lives. Some women who experience perinatal anxiety tell us that they experience very intrusive thoughts and images, which they find very, very distressing. These thoughts or images may be around the fetus dying or that the baby be born with an abnormality. Other women talk about intrusive thoughts around them harming, intentionally or unintentionally harming their baby. And as you can imagine, these types of thoughts can be very, very, very distressing and frightening for women. Anxiety just doesn't impact on how women think and feel. It can also impact on how they behave. For example, if a woman is worried that their baby is going to be contaminated by bugs, she may engage in excessive washing, or she may avoid taking her baby out in case they catch bacteria or virus from somebody outside. If she's worried about hurting her baby, She may stop carrying her baby down the stairs. Or in the case of one woman who was concerned that she might push the pram into water, she avoided walking in any public space where there might be a river or a lake or any water near. If a woman is concerned about her baby dying, she may stay awake at night listening to the baby breathing, or she may even wake the baby to check that it's okay. Anxiety just doesn't impact on the way women think, feel and behave. It can also impact on your physical body. You may experience an increase in your heart rate, or you may experience an increase in breathing. Women talk about feeling that their muscles are very, very tense and painful. Other women talk about the difficulty they experience in sleeping because they find it really, really difficult to turn their minds off and to calm the worries that are going around in their heads. To help you decide if what you are feeling is normal or if it is an indication that you are developing anxiety and you need to seek help, I'm going to ask you 8 questions that you might consider. Do you feel stressed or worried most of the time? Do you feel scared or anxious for no good reason? Do you find it hard to turn off, calm your mind and sleep? Do you blame yourself unnecessarily? Do you find yourself having intrusive or recurring thoughts and images that are upsetting you and preventing you from caring for your baby or yourself? Have you noticed any change in your behaviour, such as avoiding going out? Or are you checking your baby more than necessary? Or having trouble leaving your baby even with a trusted friend? Are you noticeably stressed or irritable when you're with family or friends? And is the worry and anxiety causing difficulties in your relationships? If you find yourself answering yes to any of these questions, or you think that your worry is not going away, or that it's impacting on your life and relationships and your ability to care for yourself or your baby, then you may need to speak to somebody and seek help from a medical professional. Seeking help is the first step in returning to mental health and wellness. Seeking help is not a weakness, it's a strength to look for support.